Hello, this is Dr. Wells with Wells Medicine, and I wanted to talk about combining TMS and ketamine today. So there are some really interesting studies coming out that combine TMS and ketamine. And they're seeing that the results are as good as ketamine or TMS by themselves. And sometimes for some treatment-resistant populations, even better than regular ketamine by itself or TMS by itself. So the studies combining TMS and ketamine did involve the regular 6 ketamine initial infusions, and they were doing TMS once a day. So the normal TMS regular protocol for depression. And those studies looked at endpoints that were at the end of the TMS series, because that included, the 6 treatments of ketamine, and then the TMS continued for another several weeks. And the results were actually better than either ketamine or TMS by itself. So that's a pretty exciting study. We're offering TMS over the course of a week. So instead of doing 40 TMS treatments, you do 50 over the course of a week. And so patients are noticing the benefits much sooner than they would if they were waiting over the course of the standard TMS treatment. But you can certainly do both TMS and ketamine within the original 6 ketamine treatments and with the week-long TMS protocol. You have some of the same caveats with ketamine, where you're going to have a driver. Even if you do TMS later in the day, you're going to have to not have anything to eat or drink with the ketamine. And similarly, when you have both TMS and ketamine, you might have a little bit of a headache. You might have some of the nausea from the ketamine, but it's a very long day spent with us in the clinic. We're really excited about these treatments, and we find that they provide exceptional results, and that our patients are really seeing great differences in their moods very rapidly.